Welcome to the Hope Podcast. My name is Jonathan James, and I'll be your host today, talking today about bleeding disorders, and specifically a series on women with bleeding disorders. I'm super excited about this 4-part series to be able to talk a little bit more about how genetic bleeding disorders affect women specifically. And today, I'm really excited about my special guest, Naomi Giron and Ivan Giron. It's so great to see you both. Thanks so much for joining me for this conversation today.
Thank you for having me. I'm excited to be here.
It's always good to see you, brother.
Yeah, love being able to spend time with you guys. We've been friends for a long time, and so it's really special to be able to spend some time together to talk about this. But, Naomi, you've been through kind of your own journey with hemophilia and trying to really wrap your head around, what is this thing that I'm living with, and sometimes the pain and the challenges that you face, and even having difficulty with diagnosis and a lot of different things. We're going to cover a lot of ground today as we talk about this, and I'm really excited to get into the weeds. But, one of the things I think is really important for a lot of listeners who may be tuning in for the first time is just wondering, first of all, what is hemophilia? What is a bleeding disorder?
Yeah, so hemophilia is a rare genetic bleeding disorder that doesn't allow your blood to clot properly.
Wow, that's excellent. I couldn't have said it better. That's exactly right. And how does it affect you personally? How do you feel? What does it do for you?
So, a big part of it has to do with the menstrual cycle for women, right? For me, when I didn't know I had hemophilia yet, I was going through a pack of pads in just 2 days. And my mom was like, that's not normal. But what I was telling my dad is, for me, that has always been my normal, Wow. And when I've gone to events and met other women, they would tell me the same things or other things that they would deal with that I thought really had nothing to do with the hemophilia, but in reality it did.
Wow.
And as I got older and I started, working out, and, I noticed that I would bruise a lot and my joints would hurt, my ankle, my knee, my hip sometimes, so it's, definitely had a big part in my life. And it's little by little, I'm learning how to take care of myself and what are the things I need to do to keep myself from getting bleeds and things like that.
That's amazing. One of the things that I think we've, as a community, sort of struggled with is just to understand how hemophilia can be, it can affect people differently, because some people have different levels. Some people have extreme challenges. Some people have lesser challenges, but they're still in need of medication or treatment regularly. And so that's been, a long journey for I think women in general, is just to understand the impacts of how it is possible. And a lot of times the menstrual cycle, like you said, is kind of the first thing that a lot of people notice, but not everyone. I have a couple of daughters that have, had challenges as well. And that wasn't the first thing that, kind of showed signs there. And I want to get into talking a little bit about, your life with injuries and growing up and all of that stuff. But, Ivan, for you, tell us a little bit about how hemophilia has affected you.
Well, I was the first one in my family born with it, so it was a surprise for my mom and my dad. She was a genetic mutation because my brother was also a hemophiliac. But, it was very hard for her just caring for us because, I was a very hyperactive kid, and I loved sports, so I wanted to play sports growing up. And I ended up having many bleeds to my right ankle with arthritis by the age of 14. I was told I couldn't play sports. So, it's hard when you tell a 14-year-old that, right? So I was in denial for several years, and I just didn't want anything to do with hemophilia. At one point, I wouldn't even infuse the way I was supposed to. So it did affect my life long-term after having, injuries. Mm-hmm. Almost lost my eye during eye surgery.
Oh, my gosh.
Because of too much bleeding. So it's affected me, but it also has made me mentally stronger. So I know, it's definitely something that can disabilitate you. So I took it upon myself to really take good care of myself and to make sure that it wasn't going to be the reason why I wasn't going to be able to live life,
That's so good.
So, over the years, it's only made me a better person. I'm now part of a great community. Mm-hmm. I've always been part, but now I get to really see how beautiful this community is. And just, all the resources that we have available to help our, family grow our people grow. As you can see, my daughter now is very involved, and she's doing her thing.
That's so good. Tell me a little bit about that dynamic as far as a dad living with a bleeding disorder, living with hemophilia, having your own sets of challenges. I mean, we could talk for hours just about all the ups and downs and, like you said, the mental fortitude that has taken you. But talk about a little bit about when did you first start to kind of see signs that maybe Naomi had some concerns that you might need to address as well?
The bruising when she was little, before her menstrual cycle, she also had a surgery and an ankle sprain that they showed us that there was something going on there. Her ankle sprain, her ankle got very swollen. We didn't know whether, it looked like a bleed, so I thought it was maybe a bleed, but we weren't sure. We were always told women don't have hemophilia, so we weren't 100% sure, but we did notice something was wrong because after a week she was still having trouble with it, putting pressure and just being able to walk on it. So,
and how old was she when this was?
Like 7 or 8. And then she had an ear infection where she ended up needing surgery. And this was right before she got diagnosed. And she ended up bleeding. We told the pediatrician that she had that I had hemophilia. The pediatricians told the doctors there, but they said no, women can't have hemophilia. But she ended up having a lot of bleeding, from that surgery. And then finally she had her menstrual cycle. And when my wife saw that, she was like, this is not normal. We need to do something about it. So from then on, we went to go get her checked, and we got a diagnosis, mild hemophilia. And we were on that path of trying to help her get the best treatment she can get.
Wow. And Naomi, when you were going through all of that as a child, like what are you thinking? Like, was it a big deal? Was it like an unknown? Like, were you confused by it?
I wouldn't say it was like a big deal for me, only because I also thought women couldn't have it. So to me, it was like, I just get bruises. Like, that was it. I thought maybe I was just not being careful. Once I got diagnosed, it was not anything that made me get scared or anything like that, because I always saw how my dad took care of himself. It was always infusing, so it was normal to me, and I never saw him hurt. So I was like, I'll be fine. If my dad's fine, I'll be fine, Just now I'm starting to understand it a little more, because when I was diagnosed, I was 11. So.
And how old are you now?
I'm 19.
19.
Yeah, so now I'm starting to see, what it's like, with just women getting help and that medication that they need, like it's different for women than it is for men. When I was little, I thought it was the same. Like, I thought it was, I could go to a doctor and tell them exactly how my dad does it. I need my factor and they'll give it to me. Now I notice that it's not like that. You have to be advocating for yourself in order to get your medication, which it shouldn't be that way.
Why do you think that is? I know we've already said several times today about that, the doctors were told women can't have it, and you were told women can't have it. As I was told women can't have it. I remember even having my oldest daughter when she was born, and we had some concerns, and we took her to the hospital, and they were like, oh, well, they, carriers, but not, why do you think that is?
I'm not even sure why it's like that, because I didn't think, when I was younger, I didn't understand hemophilia, and I knew that my dad had a blood disorder. I knew he, something was wrong, but because I didn't understand it, I never really thought too much of it. As I got older and I started to see, what it was like, I did wonder why. That has always been a question, for me. Why is it that women are just neglected? They don't get that help that they need. And that's something that I think I'm still trying to get the answer to.
Yeah, that's good. Why do you think that is the way it is?
I believe it has to do a lot with the way it was taught back then in the older times. Everybody focused more on the men because we were the ones with the big bleeds. We were going to lose our lives. Women weren't losing their lives. So they put a lot of interest, and focus on making sure that we can save the males' lives, right? And now that we've gotten to this place, we never really did anything with the women. There's no research, nothing. So we're just starting to figure this out. And insurance companies don't want to pay for something that they don't really know whether it's really needed or not, right? So I just think that if doctors now focus more on research and doing more things with the women and publishing this data and information, then, we'll be able to get them the proper treatment. And nobody can deny that once it's been proven, right, out there.
I think you're right. It does start with education. And I think, I've seen some of the medical journals and things that were taught. I mean, even now, for most physicians, I think they're taught a paragraph or two, in medical school about bleeding disorders and specifically hemophilia. And, even today, I think a lot of the material that's being taught is really just that it's predominantly a male, issue. And for people who are living this every day, like yourself, I mean, there's this almost, once you find it, you feel like you've been lied to a little bit. I mean, have you ever felt that way? You ever felt like you've been lied to? Like, I was told I couldn't have it. Now I do. And I mean, like, not just like it's a new problem. Like, you've been managing these problems on your own for so long, and then you get some treatment and you go, wait a minute, this feels better. Like, all of a sudden you're realizing, wait, this is possible. Have you ever felt that way? You ever felt like you're kind of like, I've been lied to?
Yeah, I have. And I was talking to my dad last night. I was telling him it's crazy how when I was going to get my surgery and he told them like, oh, her dad has hemophilia, they didn't want to help me or even check. Like I was bleeding a lot. So I'm just like, imagine like if I would have died or something just because they didn't want to give me medicine because I was a girl. Like that's just crazy to me. But then also when I was able to get the factor and I infused for the first time, my period was not heavy at all. And I told my dad, I was like, this is amazing. I was like going crazy right there. Like, oh my God, like I didn't know that it would help me that much, because I was so used to the, the tranexamic acid pills, that it helps, but not as much, so it was really like, I was really happy that day when I infused for the first time. I was sad when I was infusing, but when I finally was able to infuse, I was really happy because I did notice a difference.
So you were on a couple of different types of treatment before you started infusing, right? You mentioned tranexamic acid, but also I think maybe at some point they recommended Stymate or something like that. So there's other products that they recommended that are, maybe more standard because they're lesser expensive or they're not as, whatever. But did you feel an improvement with those things or was it just drastically different once you got factor?
I mean, with the pills and the Stymate, I didn't really like the Stymate just because you have to limit, how much water you drink and stuff like that. With the pills, I still bleed heavy. And there was times I didn't have my pills, so I would just go without it. And honestly, I feel like it's the same even if I don't have the pills. Like I bleed the same. With the factor, I barely bled. Like with CN, it's just like I didn't even have to use that many pads, which was amazing to me, but even with the pills, I still have to keep like one pack of pads will last me like 2 to 3 days, which is not normal. I have friends that don't have hemophilia and they'll tell me like that lasts me like 2 months, and I'm just like, not for me. Wow. It only lasts me like a week, and that's pretty much it.
You're like, I got a membership to Costco and I'm racking up and I got a spare bedroom in my house full of pads.
I wish. They're expensive. But no.
Right. So tell me a little bit. I mean, one of the things when you talk about menstrual cycles and you talk about this stuff, I know as a dad myself of girls, I have 2 boys and 2 girls, but it's an awkward conversation. Like, I don't know what that's like. I mean, bleeding is, part of my world because I have this internal problems, but we don't have events where we're bleeding out, and it's I think this is again a distinctive issue specifically for women with bleeding disorders. Like, there is an indicator that you can have this different than even what we experience as men. And so, Ivan, how was that for you in terms of just like, trying to have this conversation with your daughter and trying to even say like, I mean, I know you leaned on your wife a lot and you're just trying to figure it out, but like, how was it awkward for you to start having those conversations with her at first?
I thought it was going to be, but because when she was very little, she was maybe like 2-3 years old. I remember talking to my wife saying, I don't think I'm going to have that kind of conversation with her. That's all you, right? Like you, I thought that was going to be very awkward, but once I saw the issues that she was having, all that went out the window.
Yeah.
It was like, it's not even about that anymore. Forget the awkwardness or whatever. It's about her health, you know? And my mindset just changed, and I knew that I had to help her and educate her, and it was good for me too. You know, I won't feel that weird feeling in your stomach, you know, when you start talking about that stuff. I used to get that a lot with my wife when she used to talk about it, and now it's like, this is normal. You know? And it's important that we talk about it. You know, it's something that women go through every month. If we men understood a little bit more about it, we know how to treat them and maybe stay out of the way. You know, you know, you get to understand your wife a little bit more, and I think that's when they need the most pampering too. You know,
that's good.
You know, it's something that they have to deal with every month. It's never going to go away until later in life, and it's good to be a part of that and help support them too. You know,
and it shouldn't be embarrassing. I mean, it's a normal part of life. I mean, we shouldn't be embarrassed at all by that. And I think, you know, I talk to a lot of guys out there in the community that have maybe severe hemophilia, or they have hemophilia they've been living with for a long time, and they have daughters, and they're like, yeah, we don't talk about that. You know, I always find that to be weird, just because, I mean, I'm a communicator by nature. I think you are too. So it's like, we want to, but I think communication is so critical. And I always encourage guys, man, please, like, at least have this dialogue with your wife and with your daughters, because it really could be going on and you don't even know. Like, you don't even know that this is like, you know, because you don't, what's the old saying? Like, you don't know what you don't know. There's an aspect of it is like, well, what's normal for you might be that you have, you know, your menstrual cycles might last for 2 weeks, 3 weeks, you know, it could be long, and you think, well, that's just the way it is, you know. And we've heard of girls that don't even have a mom at home they're able to communicate with sometimes, or maybe they have communicated with their mom and their mom just, you know, is awkward about it too. And so those things like open communication, I think, is critical, don't you think?
Oh, I think it's very important. I mean, in any relationship.
That's true.
Right? So
hemophilia or no hemophilia.
Yeah, correct. And so just, you know, me being able to talk to her about it, she can feel comfortable and tell me whatever she's going through, right? So for me, it's always been a big deal.
Yeah. Naomi, was it awkward for you, for your dad to start asking questions about your cycle or whatever?
Not really. Because we have always been able to talk to each other, I think it wasn't really that awkward for me. I find it weird when girls tell me like, oh no, my dad tells me to go away when I try and bring up my period. That to me is weird, because I have always been able to talk to my dad about it. And he's understanding about it. That's what's helped me a lot. I feel like if he wasn't, then I probably would have felt bad, but he always tries to understand me. I'm able to kind of tell him what is it that's happening, or something I feel that's not normal, and he listens. And when I go to my doctor's visits, he's also there to kind of like let them know little things that I forget, you know, to mention. But it wasn't very awkward for me.
Yeah, that's good. That speaks highly of your relationship as dad and daughter. It also speaks a lot of your mom, because your mom obviously normalized that too. Like, that's not just a one, like you said, you know, it's not just a one-way, you know, conversation. And so I love that your family has been so determined to communicate and be transparent and be vulnerable and willing to have these conversations, because it is the only way forward, really. It's the only way that, and even for the whole community, I think this is true about everybody that's in the community of people living with bleeding disorders. Like, if you're suspicious or you have concerns about your daughter or yourself, and maybe you don't have a family history, or maybe you had like an uncle like 3 generations ago that somebody knew about, but you know, it could take a while before it populates. So we've known women that have literally had at age 35 having to have knee replacements, and they're going like, you know, we don't really know why. I just bleed easy, I bruise easy. That's the language used. And unfortunately, we find out later that, you know, it really could have been totally resolved if, you know, if they just had a little bit of treatment along the way. You know, they didn't have to have, you know. So I want to talk a little bit about you know, the timeline here a little bit. So you're 11, things are starting to go awry. You find, okay, there's surgery involved. You've had an injury now, and the healing process took a long time. Talk a little bit about when you first got tested. What did your levels come back with, and what did the doctors start to recommend at that point?
Yeah, so when I was 11, I don't remember a lot of what the doctor mentioned, because they spoke to my parents at the time. So like now the conversations I have with my hematologist, I do remember.
Yeah.
I know that my factor levels did change. I don't remember what they were when that day that they diagnosed me. I was so little. I don't even remember when they checked my factor levels or anything. I just remember my period.
Did you just go to one doctor, the one hematologist that they diagnosed you right away, or did you have to go to a couple of different treatment centers to find the answers?
So when we went to our pediatrician, I had private insurance at the time.
Okay.
So the pediatrician did a referral to whatever hematology I was in network with.
Oh, okay.
So they sent me to one that was not in HTC, but they did see children with hemophilia and bleeding disorders.
Okay.
So they were pretty well known, but it's not an HTC, So I know HTCs are more connected with the community and a lot of the new research and stuff that's going on.
Right.
So I was a little skeptical. When they did the test, she came back at 43%. The first time, right? But then when she just recently did them, and she was down to like 38, 36. So it's obvious her levels are fluctuating. But when they first diagnosed her, they did the desmopresent test. So basically a stymate test. You will see what her levels would be like when she's on stymate, and she went up to like 75, 80 while she was on stymate.
Oh, wow.
But again, the stymate's a temporary thing, right? It doesn't solve the problem. And you're really just taking the factor VIII reserves, right? So you're leaving her with nothing. What's going to happen during that rest of those other 3.5 weeks, right? Because you can only do desmopresent 2 days. We start, and then you every other day after that. Well, just twice though, right? So it's been one of those things where I'm like, what's the point of that? They wanted to give her birth control, but I always felt birth control has other side effects that I feel she shouldn't have to go through right now as a young girl. Like, let her body naturally develop, right? Instead of bringing all these other things into her body, they're just going to mess with her. So we didn't want to go that route. And the tranexamic acid, we went there, but like she said, it's very small difference in the bleeding. So that's when I was fighting for factor, but in order for us to be able to get her factor, you need to have proof of her having injuries and things like that, right? So, working in the medical field for 15 years, I worked with ophthalmologists and stuff. I always loved it when patients came in with their documentation of everything they've gone through,
Yeah.
Some people would get annoyed because they'd have to enter all that in, but I loved it because I knew what was going on with this patient for a very long time, which gives you really good information on how to treat this patient, right? So the doctors were very happy about it. And I say that because I was always the one putting in information for the patients when they would come in. So I loved it. And, the doctor would take a look, and it was easier for them to make the recommendations and treatment plan. But with her, it was a little different. We had to start and we took pictures, little journal, and I tell her now to like keep track of everything, all the little things, So then that way, when you come to the doctor, you have this you can show the doctor like, look, I've been struggling with this for a while. We need to do something.
And one of the reasons why that's important, I think, is because the doctor a lot of times is also having to answer those questions. And if they just say, well, the patient told me this or that, it's not concrete enough, right? So they actually, in order for them to go to bat for you, whether that's to the insurance company or what have you, it's usually that they have to have some sort of tangible proof to be able to say this is what it is. So journaling is really critical, largely for insurance reasons. But if you do that legwork up front to be able to provide the physician with that material, then it gives them something concrete that they can actually fight for if they have to do the reporting, right?
Correct. That's it.
Yeah, so super important, I think. How has that made you think about things as you even think about the future? Do you feel like are you good at documenting, or do you feel like I just hate to have to do this? Do you like it? Do you not like it? Do you see the purpose in it?
I do like it. I've always liked to write things down, and even with the pictures, I noticed how much it did help, showing her, because she wouldn't believe me sometimes. When I'll tell them, oh, I got my knee got really swollen and everything. I tried to tell them and they were like, no, that doesn't really happen with women. Once you went in with pictures, everything, that's when they were able to see that I was not lying about it. I wasn't exaggerating or anything, So I do see how important it is to have a journal and write everything down, have pictures and show them to your doctors when you go so then they can see and actually be able to help you,
Mm-hmm. That's so important because I think a lot of doctors are well-meaning as well. Like they want to help. They're not trying to be, unhelpful. Mm-hmm. It's just that if they don't have anything concrete, it's really hard for them to go to bat on our behalf, right?
Yeah, it is. And there are some doctors though, and I'm being honest about this, that are still with that old school mentality. Mm-hmm. So it's going to be very difficult to make them or help them, kind of change their mind about things if you don't have that stuff.
Yeah.
They're just stuck in their old ways, and it's hard.
So what would you say about people that maybe have gone to a doctor that they, somebody has said, I think I have this issue. I'm really struggling with this. I'm not sure. Like and the doctor's really dismissive. Like, how should somebody handle that?
Well, first of all, you definitely want to start documenting everything you're going through for sure. Right. And then if you are not happy with the outcome of your appointment with your hematologist, I believe that patients always have the right to a second, third, or fourth opinion if they want to, mm-hmm. right? But you have to have a reason for it too, right? You have to have documentation. You have to show the doctors you are having problems and that whatever that you're just not happy with that for whatever reasons, right? That way you can go to your primary care and they can send you to another hematologist in your network. Go see what they have to say. At the end of the day, this is a conversation that you have with your doctor. You both have to come together, to execute the treatment plan. Mm-hmm. And I believe, as a patient, you have to be also comfortable with what the doctor is trying. And, doctors have to be able to prove and talk to you also and let you know, like, hey, this is why we're doing this course of treatment or plan, right? Because if the doctor's just deciding for you and you don't know why, you're just going with whatever the doctor says. I just feel that you're basically just relying on whatever the doctor wants to do with you. You're not part of the conversation, the plan.
Right.
And I believe patients should be part of the conversation, right?
It's good. I always feel like that medicine is always, in just the practice of medicine, I mean, they still talk about attorneys and doctors this way, is that they're practicing, right? I mean, there's a constant change of learning that's going on, I think, for everyone in the medical field. And most doctors are very, forward with admitting that. But I think that that there is this, it is difficult to see change occur when something is really, starting to realize. I mean, think about it. Just in our generation, one generation ago, they didn't even have the ability to do a blood work to be able to even detect what your individual factor levels were, your clotting factor levels individually. And we have that now. And so, and when it first started, it was incredibly expensive to get it done. And you had to ship it off. And there was only like 2 places in the whole, country that could even do the test. But now that's become more and more common. And so there's this apprehension sometimes just of the cost of testing. It's not even, it may not even be the treatment itself, although that becomes another hurdle. But there's a lot of hurdles. I think they have a lot more burden on the back end than what we all see. And so it's easy to get critical and cynical sometimes, but I think it's healthy for us to have a little bit of empathy for them as much as we're expecting for them to have for us. But one of the things that I find is interesting is that I do believe the practice of medicine is also very backward looking. They need 20 years of research to really feel confident about saying this is what it is. And what we're seeing happen now in the season of discovery that we're all in and multi-generation approach to hemophilia specifically is that this idea that women not only do bleed, but they not only have hemophilia, but they do bleed regularly, and it looks different. Like your bleeding episodes were different than Naomi's bleeding episodes. Naomi, yours was different than your dad's, and you're very well managed because you're an amazing dude that has a great sense of responsibility and has stayed faithful. Some of that's because you experienced the hardships of not getting treatment, but on your side of it, Yeah, I would even say for me as well as a person living with hemophilia, like the diagnosis piece was still a challenge. It was almost 2 years. I was almost 2 years old before, and I had severe less than 1%, factor level. But it took them almost a year just to get to the right specialist that knew what test to even do. And that was, so there was challenges, but when you have studies and educational material out there saying it cannot be from 20 years ago, and that's still the material that we're talking about, that physicians are being educated on, that plays a significant role. So I think there's two ways to change that status quo. One is, and I think we need to do an all-in approach here, but standards of care have to be addressed, which comes from, physician groups and, the clinical research side. But I also believe that the patients, we as a patient, we have a voice that needs to be heard. And if all of us collectively started asking more questions and started going with journals and pictures and information, I think it really starts with our own ability to know that we're confident that these are issues that we're having that could be solved by treatment, but also just being able to put the pressure on the system, because it's not just one doctor standing in our way. They're not even necessarily trying to do anything to be harmful per se, as much as it is that it's nearly impossible sometimes for them to get an approval or to even prove the case why this treatment is being, because the system has been wrong for eternity. So I think that we're on the right track, but speaking up is so important. And that's why I'm so, inspired by your courage and your bravery to lean into this and start really advocating for yourself and speaking up. I want to go back a little bit to your injuries and talk about, I know you had an instance with your ankle and then maybe another one with your ACL or something that you had trouble with your knee. Have those injuries continued to be a weak point for you? Or are they continuing to be an issue?
Yeah, they have. With my ankles, I sprained both when I was little, playing outside. And then we had a dog too, and she dropped me a couple of times. So I sprained my ankle. Now I notice, if I'm walking for a long time, my ankles hurt. Or if it's really cold, my ankles, they get really sore. They just start to hurt. I don't know, where it feels like a bruise, when you're pressing on it. That's what it feels like. With my knee too, I started working out and I noticed that my knee would get a little swollen, my ankles too, and I had to stop for a little bit and then go back again and try it again. I couldn't even do a squat or anything because my knee would hurt. Or any wrong step, I would just re-injure my knee.
Right.
So I have noticed that, that pain never really went away. The injuries never really healed in a way, because one wrong step and again, I just re-sprained them or re-hurt my knee.
Mm-hmm. Do you think, Ivan, that that's partially related to the fact that she was not getting ongoing preventative treatment at the time?
I think it has something to do with it because, you and I know how bleeds work, right? They deteriorate the cartilage and eventually it becomes a problem, right? I know that she hasn't gotten to that point, but I know that she had it just keeps happening. So I know that there's inflammation there for sure, right? Maybe not big bleeds like the way we did, but I know that there's also the possibility of microbleeds, right? And those microbleeds over time do damage the joint. So she may be having some issues. They may not be as bad as the ones we go through, but if she continues this way, by the time she's 40, she will have joints that look like my ankle and stuff,
Right.
So that's what we're trying to prevent. We're trying to keep it from getting that serious.
One of the things that we know is true is that once the integrity of the joint has been degraded, there is no returning it. It doesn't heal. It does, cartilage doesn't regrow itself. There's some fascinating new things happening in stem cell research and all this stuff that could potentially come down the line in the future. But right now, for the most part, our bodies naturally don't restore cartilage on their own, or they don't restore bone that has been, eroded away because of the enzymes that create this, attempt to try to clean out the synovial fluid. So I think one of the challenges that we have to be vigilant about is prevention, what is the old statement? An ounce of prevention is worth a pound of cure. There's a sense here that there is the prevention is really could be, something by just treating ahead of time. And so I guess that leads me to my next question for you is, I know you got diagnosed, which is yay, amazing, right? And then on top of that, you got treatment, right? Are you getting treatment regularly and preventatively?
So I was able to get my factor.
Okay.
So now I have been trying to learn to infuse and things like that. The only thing is my veins are a little too small. I can't even really see them. So that's the struggle now. But I have been able to get that. And I'm happy that I was able to finally get to this point. And I do notice that it does help. And, the process was a little hard, but now, I got my medication. That's what I'm very happy about. And I do notice a difference. So.
Do you feel like that you're getting enough preventative treatment?
No. Because she complains a lot about, when she, in her menstrual cycle, she only gets enough for her menstrual cycle, right? Yeah. And I told her.
So just once a month, is that right? That you're getting an infusion?
Just for when I get my period.
Okay.
So
they're not really solving for preventing joint degradation. They're really just solving for excessive bleeding during the menstrual cycle.
Correct. And that's why we're still in the process of trying to get her proper treatment, right? Like we were able to get the doctor to say, okay, for the menstrual cycles, but it's obvious that she continues to have issues with her joints throughout the month, especially when she's active, right? So that's what we're trying to get the doctor now to prescribe something prophylactically, right? Because I feel that would definitely help her. And the issue again now is just trying to prove it to the insurance companies,
Sure, building a case. Mm-hmm. Do you feel like when you do take factor for your menstrual cycle, do you notice a difference in your joints too, or is it just kind of like you just don't know?
Yeah, I did notice a difference because the day that he infused me I was on my period, but then I had also had hip pain because I was working out. Oh. And I noticed that it helped a lot. Like I didn't really feel the pain anymore. And I was telling my dad, I think that the factor helped. I didn't even think it was, but then when I told him, he was like, yeah, it's supposed to do that. I was like, yeah, but I don't feel it anymore. I was telling him my ankles felt good. My knee felt good too. So I did notice that it did help a lot.
Wow. That's great. Well, I think, the fact that you have any treatment at all is excellent, right? But there's always ways to improve. I know just recently I went for my annual visit and in my case, my doctor was like, look, we're only correcting to 60% for your prophylactic dose. And so we think we could do better by going to 100%. And I honestly didn't think it was going to make that big of a difference. I've been treating, my whole life, and I thought, it's whatever. But that, I'm telling you, like after a few weeks of that, I felt like a new person. I was like, I don't feel sluggish in the morning. I'm not dragging myself through the end of the day every day. I'm not, I was really like, I didn't realize how much that I was managing the tensions of the inflammation in my body so regularly and my joint pain and all of the things that went along with that. I didn't realize how much I was doing that until it was gone. And I think that that's one of the challenges that we really have to continually push. This is one of the reasons why you advocating for your doctor and advocating in moments like this to help encourage other people to step up and ask more questions and keep pursuing. Because we don't know what we don't know. Like it's not until it's fixed, the problem is starting to be solved, that you start to realize how bad it was before. I think at one point in time, we were all living in caves, probably as cavemen, or something, and women. But then we build houses, and we're like, oh, well, this is better, And you don't realize, and then we end up. My wife and I like to watch these period shows, and we were watching one not long ago, and they didn't have a bathroom in the house, and it was like the King of England, and he's like, we're going to have a potty in the house, and one day every person will have a potty in their house, and I'm thinking, it's so bizarre to me, but if I didn't have that in my home, I'd kind of think that was, boy, that would be suffering, and so you don't realize, like, it's not just a convenience sometimes, it's actually about safety, it's about It's about managing like long-term health. I think
Quality of life.
And if you look at quality of life as being just a anecdotal approach that we have to try to sort of like incrementally improve, okay, that's one way to look at it. But truly, when you're living with this, you can live like a prisoner in your own body, and you're struggling, and life is hard. It can affect your career. It can affect your ability to be present with your family. It affects everything. It's pervasive in every area of life. And so, man, I'm so encouraged and inspired by seeing you just step up and advocate for yourself and keep pushing that forward. And we're all cheering you on. Keep going, keep doing more of it, because it's really important. It's not just for you, it's for the whole community. And we want everybody to do that, because the more that we all ask questions, I think that's the way the system changes. And we're early, but I do see that this is an area that I feel like we're going to see change, hopefully in our generation, where one day, we might come to a place where this really, where women can be diagnosed as early as men are. They can be diagnosed and given preventative treatment. We have a lot more women right now that we're hearing from regularly that are getting diagnosed, but not getting treatment at all, not even during their cycle. So you're a little bit, further along than some, but I certainly hope that we can address the joint pain. That is a solvable problem. And so I want to keep pushing that envelope and keep sending the right messages to the physicians so that they can continue to do the research and fight the good fight with journaling and, providing that information. It's all so critical. It's so critical. And so I'm excited for you in that. And does that seem to give you any hope for your future? Like to know that maybe one day you might be able to get treatment more regularly?
Yeah, it does. And also, keeping in mind when I start my own family, being able to advocate for them and help them, so it does. I'm glad that at least now we're starting to see a bit of change, but I would like to see one day that, a girl can go to the doctor and be like, what, I think I have hemophilia. And they'll be like, okay, let's check right away. Instead of just being like, no, you don't, and having that help and being able to say like, what, I think factor will help. And then the doctor say, okay, let's do that. Let's try it, instead of just pushing that aside and, giving them other options.
So good. I was just having a conversation with one of the research physicians in the hemophilia community, and he brought up an interesting point. He said, you talked about your first level was 43%, your next level was 38%. I think for folks that are like in my case, I think largely what the problem that was trying to be solved, and when I was born in the 70s, it was like, we got to try to stop these guys from dying. That was the main thing. And then the second thing was that we were labeled the crippling disease. So it's like, let's try to limit crippling effects if we can. And so now there's this advancement where we can see, we can look at the levels and we can see how they change. And so in my case, I don't really make any factor VIII. And so, so seeing fluctuation levels is also kind of a new area of scientific exploration in a way. Like we haven't studied that very long. I mean, you think about it, it's like 20 years, maybe we had the technology, but it wasn't being tested regularly, right? And so one of the things that I'm super excited about is to see like the more that we do this testing and see and track levels. And, I always thought it'd be fun and really amazing. I'd love to see this happen. Actually, there's a couple companies that worked on this to try to actually get like a diabetic screening where you could like prick your finger and see what your levels are, which would be so fascinating. But they've not been able to bring that to market, and who knows if they will ever be able to. But surely, there's a way to get to the point where we could really check levels regularly and see that fluctuation, because some doctors, have proposed the concept that hormones can influence, and the changes in your hormone, even for men, can change the way that factor levels change and so on. The reason I bring this up is because I think as it pertains specifically to correcting, some of our listeners may not know this, but 50% has always been sort of labeled as like they don't see as much internal bleeding activity going on if you're under, if you're over 50% or more, they don't see as much. And really the main thing that they were trying to solve for, of course, back in the 70s and 80s and 90s even, was spontaneous bleeding, which was just like you just have these flare-ups that come out of nowhere, not related to trauma, not related to activity, but or surgery, but like really connected to just inflammatory response in your own body. So they were trying to solve for that. We would call that severe. But I really am of the mindset we need to get rid of this mild, moderate, severe language. I think that's been very harmful for progress, and that's something that I believe it needs to change. But I also think that it's really important that we also look at the level, the range. A lot of people don't realize this. There's some disagreement between CDC and NIH and some of these other organizations, but basically it's 0 to 200% is actually the normal range. So when you take 50%, you're really still only talking about, very low end of the spectrum. And so I was talking to this research physicist recently, and he was talking about, he says, we haven't observed this long enough to know, but he said some people, their normal levels, they might feel at optimal health by having 150% level. And maybe somebody else has a 20% level and they feel they're not having any spontaneous bleeding. So we don't really know exactly, because obviously it's not just, we look at the one protein, but we don't always know, is it just that one protein that's the problem, or is there other mechanisms going on? Because there's 13 factors in the clotting cascade, and there's a lot of other things going on in there that are just besides that. So I guess the point of that is that there's so much more to discover and so much more to realize. But I guess one of the things that frustrates me, and I'd like to know how y'all feel about this, but is why are we just so dead set on only providing treatment to people to get them to 50%, or to only treat them if they're below 50%? I mean, if you're less than even 100%, you really probably could benefit from some level of additional supplemental treatment, right? I mean, you've seen that in your own body. At 43%, you're having all these challenges. At 38%, you're probably having more challenges, right? And so what would you like to see in the long-term future? I mean, I would love to get rid of mild, moderate, and severe. I think that's a gradient we need to totally excuse. And also, I'd love to see us get to where we're not arguing over 50% or above 50%. I mean, what do you guys think?
Yeah, I mean, just like you mentioned, I think that a lot of times people don't realize how we're all going through the same thing. It can be different for everybody, right? But we all, have similar injuries. It takes long for us to heal and stuff like that. So I feel like people shouldn't be told oh no, but you're not like this person. I don't feel like people should be comparing each other. We should all be able to understand each other and be able to be so open about it and talk about it. Because that's one thing too, I noticed that a lot of times women don't want to talk about what they're going through because they just feel but it's not as bad as men, and that's what I would tell my dad too. I would go and talk about my story. And at first when I went to something called Future Leaders.
Okay, yeah.
And my first year...
Northern California, right?
Yeah, in California.
Yeah.
My first year, it was just all boys, mostly boys. And then the other two girls didn't have hemophilia. They had another bleeding disorder. So I was grouped with the guys, and they were talking about all these injuries they got and, how they infuse and things like that. And mine was just about my period. And I told my dad, I was I felt like my story was so boring. I was because I had nothing to say. I felt like at the time there was nothing for me to talk about. Now I noticed how much it's, impacting my life, all these injuries that I'm getting, bruising and things like that. And, the process of getting my medication. So now I feel like I have so much to add to my story. And I feel like that's something that women should be able to talk about, everything that they go through. Because when you're able to relate, I feel like that it's really good. Going to women's events and I meet other girls and they start telling me, oh, I'm going through this, I'm going through that. And I'm just oh my God, me too, so we get all happy trying to explain this, and with the guys, they're just ew, she's talking about her period. And I'm but with the girls, it's not like that. They're oh my God, yes, and this too. And I'm oh my God, and I just feel so happy. I leave and I'm all happy, Wow. So I hope that one day we're able to be open about it, and not have to worry about being scared or judged about it.
That's so good. That's so good. It's so very well said. So would you encourage other girls that maybe are still trying to figure out if they have this or they don't have this or they don't know, would you encourage people to go to events in the community?
Yeah. And for women, especially those women's events, I just went to a women's retreat and I told my dad I was so happy after. I met girls my age and they were telling me little things that they're going through that I'm going through right now that I didn't even know could have something to do with the hemophilia, So I think that those events do help. You're able to just educate yourself and learn to advocate for yourself, going to the doctors, and talking to them about what you're going through. So I would encourage them to go.
That's so good. So good, Naomi. Oh my gosh. You're like the super example of going to all the events and being involved in the community, but you weren't always that way, right?
That's correct. Yeah. My last event that I did was probably Future Leaders Program with the Hemophilia Council of California in 2006. My son, who's 17 now, was about to be born that year.
Wow.
Yeah. And after that, I just said, life,
Yeah.
Two kids, I had to start working.
Right.
I had no time for anything other than just make sure that I could put a roof over their head and food on the table, But when I found out she had mild hemophilia, that's when I said, okay, I need to educate myself. I need to get involved. It's not about me anymore. And that's what got me to come back to the community. And kind of going back to what you said earlier about severe, moderates, and milds, I also believe that we shouldn't even classify it as that, right? It should be classified as a deficiency, period. Right? Because
Absolutely.
I have a friend I grew up with that we went to camp together, and I still see now. And he's a severe, and he didn't have prophylaxis treatment until he was already like 11, 12.
Wow.
But he has no leg injuries or anything like that, no target joints.
Wow.
Just a little bit of an issue with one of his shoulders. I, on the other hand, went into prophylaxis at the age of 10 because I had too many bleeds on my right ankle, and I'm moderate, right? So it doesn't really matter whether you're severe, mild, moderate, right, quote unquote. It's just your bleeding episodes. So that's why I also think women with hemophilia, just because they're mild doesn't mean they have factors, so they're good. It only makes sense if 100 to 200 is considered normal. It only makes sense to correct it to that much, right? And it makes sense that we feel better because if we know how products work, it has a quote unquote 12-hour half-life. We would talk about standards, right? That means that if we're corrected at 200%, 12 hours will be at 100%, 24 hours will be at 50%, and then 36 hours will be we'll still have pretty good amount of factor levels. If we're corrected at 60%, in 12 hours, we'll be down to 30. So we're already mild hemophiliacs right there on the spot, So.
And she's over here having bleeds at 43%. So like, how much more are we, if you're at 20% or 15%, I think that there's this misnomers, like if you have, and again, keep in mind the system, the framework that was built around these numbers was all basically trying to avoid crippling disease and that was observable within a few years. I mean, it wasn't, it was about avoiding spontaneous bleeds, which, it's just the very tiptoe of the surface, right? It's not the main problem. There's so much more to this whole, clotting cascade and how it works and how we can avoid other types of damage, not just life-threatening damage.
Right. And that's why I think that documentation generally is really important for all patients, right?
So
because,
good.
Some women do have a lot of issues. Some don't. It's not it's not as bad, right? So
It's not one size fits all.
Correct. So if you're able to bring this to the doctors can make a much educated plan for you, and they can decide whether they need to be more aggressive or not.
Yeah. That's so good. I mean, we have friends, in the community that have, I have a really close friend of mine who's severe, less than 1%. I mean, the guy hadn't had hardly any bleeds. He's older than me. We have lots of friends like that. It's like you can have two brothers in the same family that have the same diagnosis and the same quote unquote, class, if you will. They're both severe. They're both moderate, whatever, and bleed totally differently. Yeah. And so there's still so much that we just don't know. And I think the only way to fix that would be to just, for us to all sit around with an IV in our arm 24 hours a day to find out, maybe we'll have one of those Dexcom things one day that just tells us what our levels are on our phone all the time, like diabetes. Yeah. I mean, how cool would that be? Yeah. But there's this premise though, that we don't know what our levels are and we don't know how, even if the level is low or if the level is high, it doesn't really necessarily mean that you do or don't have inflammation or you do or don't have microbleeding, or you do or don't have other issues that's causing damage to the structure of your joints, causing damage to the structure of your muscles that you cannot regain or rebuild. I mean, there's some real challenges here that I think what's really hard, long-term outcomes are hard for everyone. I mean, it's hard. It doesn't matter if it's about school. We were talking about that yesterday about school and education. It's like you got to invest your time and energy into that, boy. But after you've been through high school for 12 years and then you're going into like another 4 or 5 years or 7 years of school. I mean, that's like, it's a long road. It's hard for anybody to get through anything that takes a long-term discipline. But the only hope, I see guys right now that have severe hemophilia that refuse to take preventative treatment. I mean, that should not be. Yeah. Now, clinically speaking, that's not because the doctors and the system doesn't recommend it. That's because the patients don't adopt it. So it is a twofold process where, and I always tell people this, there's only 3 people sitting at the table of making a decision about a drug or a product or a treatment. And that's the provider, which is the insurance company, right? I mean, the payer, which is the insurance company. There's the provider, which is the doctor, and there's the patient. Well, 2 of the 3 of those have to be in agreement to move forward with a particular treatment plan. And this isn't like, going to a cardiologist where you say, there's 500 drugs available. We'll just pick whichever one you like. It's not like that. This is something that's really, that quality of life piece is so huge for any rare disease, but especially when you've got treatments and everything, and there's so many variables at hand. It really takes, I think if as a community, we understood that we sit in the driver's seat of this deal, I think we would all be, if we were really empowered and educated, self-educated to the point where we understood we're in the driver's seat in this deal. I mean, arguably, the doctor is giving us advice. The doctor's not the one that actually should be making the ultimate decision. We should be the one making the total decision. The doctor is giving us guidance, and we have the best chance at knowing scientifically what's going on because of our relationship with our doctor. But really, we should be the one in the driver's seat. And I think far too often, so many people in patients and community, whether you're newly diagnosed or you've been around for a long time, or you're just discovering that you have it, that you were told you couldn't, it doesn't matter what end of the spectrum you're on. I find probably the vast majority of patients kind of sit in the back seat. We're not even in the passenger seat half the time. We let the doctor sit in the driver's seat, the payer, which is the insurance company, sit in the passenger seat, and then we sit in the back seat. And that should not be. We got to do a rotation here and get in the driver's seat, which is where we're intended to be, where we should be. And we're the ones that have to take the medication. We're the ones that have to infuse and go through all the trouble of the transferring of this medication into our bodies. We're the ones that have to live with it. I always tell people this, again, this is not negative on doctors, but you will live with hemophilia longer than any physician that you go to visit to treat your hemophilia. They will retire before you stop living with hemophilia, or in this case, stop living. But think about it. You'll probably go through 2 or 3 physicians before the end of your life, and the likelihood that no physician is going to know all the answers, and that's not their fault. They're doing the best job that they can, and they have a lot of tensions to manage that we don't have. But if we understood our position and our authority, I think we could influence change a lot more rapidly, and I think that that's super important. Yeah. So I applaud y'all for all the work that you've done and all the heavy lifting you've done. It's a lot, but it's the only way to really make, change and better outcomes for yourself for sure, but better outcomes really for the community too. I want to go back to one piece of this that I don't think we've talked about yet. I think it's super important is the infusion piece, because, oh my gosh, like that alone can be enough to make you want to give up sometimes, because it can be traumatic. I mean, trying to stick a needle in your arm is not, or your hand or wherever you stick a needle can be, I don't even want to get my ears pierced. We talked about that too, I mean, y'all are braver than I am. How do you address has getting infusions or even getting blood work, has that been difficult for you?
It has. and I didn't even think it was going to be a problem. We were all happy because I finally got the factor. And then after, I was just so sad when my dad had to infuse me. He had to poke me a bunch of times just to get my vein because we could not see it. Yeah. And we had a nurse go over to teach me how to self-infuse. I don't like needles. I don't like the idea of it. My dad does, and it looks so easy. I'm able to infuse my dad. I just can't infuse myself. Yeah. Which that's what frustrates me. You know? And I was able, we were going to do it by, like, I was going to do it on my own. Mm-hmm. And he was just right there watching me. He's like, you're going to do everything. I couldn't, like, I would get really close with the needle. I'm like, no, I can't do it. You know, and then I tried and I think I missed. So I was like, no, I was already getting upset. Like, I was just like, I can't do it, you know? And my dad was able to infuse me twice already. And I've had the factor for like, maybe like 9 months already. And that's sad. I haven't been able to infuse, but we're trying and I'm learning, but yeah, it has been hard for me.
Yeah. And Dad, I mean, you're a pro at this. You're infusing yourself, setting your own IVs regularly, doing your thing. Were you like kind of overconfident about going into this with trying to infuse her?
I thought I was good at this, bro, and I realized I'm not as good as I thought I was, man. I mean, look at my veins, dude. There's no way anybody can miss that. People can practice on me and they'll get it, right? Yeah. So this is easy. I thought it would be easy. She practiced on me. I figured she's going to get comfortable with it. I feel bad for her that she got her confidence up too, because we even went to a Quest Labs. They couldn't get it. Oh, wow. So it's not just me. She has very tiny veins.
Yeah, they went to 3 different Quest Labs.
We went to a few. And the only one that was able to get her was when we went to the HTC with the phlebotomist that does little kids.
Wow.
This guy made it look easy.
Yeah.
I gave this guy props. Right. I was like, dude, this is awesome.
You're like, how much would it take for me to have you come to my house to do this?
Yeah, that would be cool. But, you know, we trying to get her nursing now. We had a nurse come over, teacher. She felt comfortable while she was there, but she still gets nervous. Mm-hmm. That's the problem. She'll get nervous, and
which can affect the veins. I mean, you can they can disappear on you because you start getting nervous. Or
I've been like that since I was little, though. And then as soon as they start counting, I'm like, please don't, just do it. I'm like, just do it. But they're trying to teach me to do it on my own, and I know I have to learn that, obviously, because when I decide to have a family too, and having to infuse my kids and everything, you know, so I know that I have to learn. It's just, it sucks because I can barely see my veins. Like, I was like, it's right there. No, I'm telling my dad, and he's like, well, I don't know. He's like, do you think it's there? And I'm like, well, I don't know. You know, so it's just like,
because I feel like touch, you know, really get to feel how it feels and stuff like that, right?
We've done that though. Like we've thought we had the vein and it looked like we were there, and then he would put it inside the vein, and then we just realized it wasn't even there. Like, and we were just like, oh my God.
That's the worst.
It rolls, and I've had to poke her about 4 or 5 times, dude. Yeah. And that's what I don't want to do.
Yeah.
So that's why we're like, let's just get the nurse, you know? But you know, the crazy thing is that, this does happen a lot. Yeah. Right. I have friends that they've told me, like, man, I have a hard time. They want to get a port. Yeah. Things like that. So I'm just like, okay, well, it's not just her, you know, and she doesn't want to get a port. And I respect that, you know. I told her it would be easier, but, you know, at the end of the day, she has to make that decision. If she doesn't feel comfortable, then that's fine. But I told her, you have to just learn how to infuse, you know, because you have to know how to do this. Yeah. And, you know, she'll have to practice on her kids too, so.
Yeah. Yeah. It could take a long time. I mean, it really can. Like, I mean, I know for me, like, I was spoiled because I learned how to infuse when I was 8 to self-infuse, and I got it the first time. And I was like, you know, a magician. Obviously, I was professional. I knew all of it. I was super hard stick as a kid, super hard stick. Like, they would, you know, 10, 11 times sometimes in the emergency room, couldn't get it, you know, really hard. But, you know, so I had a lot of trauma. Like, I probably should be in counseling still or something, but you know, it was hard. It was really, you know, traumatic. And I started learning. And so the first time I got it, and I'm like, rock star, I got this, you know? And then, you know, the next time I missed, and then my whole world fell apart. Like, I just thought I'm never going to be able to do that. I mean, the emotional swings you go through and this stuff is like not for the faint of heart. I mean, you talked about this at the beginning about the mental fortitude that has made you stronger. I think about this. I mean, some of the things that we learned sometimes just from the infusion part, which is not even dealing with really the disease yet. It's just the transfer agent that we have to use to do this, you know, can be enough of a problem that it really can be very, very hard. But when you look at the future, like, and you've watched your dad, like, I mean, one of the things you said at the beginning of this conversation was that you said, man, I saw my dad, he was taking care of himself. He was infusing regularly. He was disciplined, probably because he was trying to show off to make certain that you knew he was going to be good at it. But like, you know, in this process, like you're looking at him, does that give you hope to like feel like one day you could be confident and one day you could handle this?
It does. And that's something that I always tell my dad. You know, I don't know if I would have gone through it without him because he has helped me a lot, you know, through everything, you know. And even when we went to the hematologist, going to my appointment, like, if I can't get through to her, I know he can. So I'm always like, I'm going to be good either way, you know. So I hope that I can be like that for my children in the future, so you know, like they can be like, yeah, my mom's going to get through it to them, you know, she's going to help me, you know. Even with the infusing part, because he has always been infusing everything, I know I have to. Like, I think if, you know, he wasn't good about it and he kind of just, you know, let himself get injured and all that, I think maybe that would have changed my mindset. But because he has always been taking care of himself and he has set that example for me, I know that I'll be able to do it later on. Even when he's there, I know he'll be there to help me too. So, and we have such a great community too. You go to the events and you meet new people who are going through the same thing as you and, you know, everything that they talk about. So I know I'll do good later. I'm not afraid about that, you know, but.
That's so good. I don't think that's something that I had as a kid because I saw a lot of trauma around me for sure because we were dealing with HIV and hepatitis C and a lot of people were, it was really detrimental and the community rallied around a lot of that trauma, which was important to rally around. But man, you can never underestimate the strength of having friends. And, you know, there's an old saying I see float around on social media. Sometimes it talks about like, you know, the friends that are like family are the ones that you get to choose. And those are sometimes better than your blood relatives, you know? And I'm like, man, there is something so special about having friends that go through common challenges that you can look at and go, man, this gives me hope because I know I've got this community around me to support me. And I know I can pick up the phone and, you know, when I'm really going through hardship and these people, even just knowing that they're fighting the same battles that you sometimes just give you peace, right?
Yeah.
Yeah.
So good.
Yeah. I think community is very important, right? Especially for new families. They need that support. They need to know that their child's going to be okay.
Yeah.
That what they're going through is normal. But as long as they take the proper steps, they'll be fine. You know, everything will be okay. Especially now, new medications. You know.
Continually getting better.
It's better for parents and the young kids as well. So it's looking bright. You know, and you know that's why I continue to advocate and have my daughter also very involved because I know that there's a lot of change that still needs to be done in the community. Mm-hmm. And like you said, we want to help, you know, let our voice be heard and start initiating a little bit at that or be part of it, you know. Mm-hmm. But she has a future where her children might have it. So she just needs, I want her to be prepared.
Does that worry you at all that you might have a son that might have hemophilia?
It does a little bit. You know, I was telling my dad, because obviously you don't know how your children are going to be. I know my grandma was telling me stories about he used to jump off of things and everything. I'm like, what if I get a kid like that and he has hemophilia? I was like, I'm going to be scared.
You will.
You know? But
you will.
I know,
if your dad was like that. I mean, all boys, right? But come on, let's be honest.
My grandma told him the same thing and we didn't come out like that. So I'm hoping that, you know, my kid doesn't
That's because he had your mom to balance out the gene pool. But let's just be honest. Your mom's like bringing the level-headedness to the equation, you know?
Yeah, but I hope, you know, that they don't end up like that, you know, but I know that I'm going to be able to take care of them and help them. You know, my mom had recently shown me a video of a mom infusing her baby and I felt so bad because I just told her, I was like, I don't know if I'll be able to do that. You know, just like it's hard to watch that, you know, so imagine a mother having to take care of their child with a bleeding disorder, you know, you know, keeping them from getting injured and things like that, you know, so that's something I think about. I try not to think about it too much because then I'm just going to worry myself. But I know that I have, you know, my parents there to help me. My dad has been through this. My grandma has also taken care of 2 boys with hemophilia. So she knows a lot about it, which I haven't really asked her about it. You know, I have to ask her, you know, how she managed to do that, you know, not knowing a lot about it. The community was not as big back then. I don't think so. So she never went to events or met other families, wasn't able to relate to them. Wow. I mean, I think the good thing now is that we meet other families and they tell us their stories and we're just like, wow, like they're going through the same thing as us. So I'm glad that I have a community like that. I have my parents, you know, my brother too. He grew up with me, you know, so he knows all of the things I go through and he's able to help me as well. So I'm glad that's what I have. Yeah.
Yeah. And that's got to give you a lot of hope for the future, just to know that even no matter what you face, you're going to have support, not only from your own mom and dad, but also from the community and from the people around you. And hopefully the medication and treatment. I mean, we've seen a lot of improvements in our lifetime. I think we'll continue to see a lot of improvements in the future. And hopefully the diagnosis process will get better, you know, for all of us. But I just think that, you know, that there's, you know, hopefully that gives you some, you know, peace of mind. And I will say, just as a thought, I've heard people in the community, and look, everybody's entitled to their own opinions and their own thoughts about all this. And so I don't judge anybody for feeling whatever kind of way, but I do feel like that so often that, you know, it's always sad to me when I hear people say things like, you know, well, I know this is another thing I want to get rid of is the language carrier. I think that's got to go away. Yeah. So, but I hear people say it in the community. They say, well, I know I'm a carrier, so I'm not going to have any kids. And I'm like, oh, that's just so heartbreaking to me because I have my 4 children. 2 of them are affected. I'm affected. Like I would never want to give my kids up for the sake of, you know, or give them back because, you know, I don't know if you can even do that, but, you know, but I've never tried, don't want to, but you know what I'm saying though? It's like, you don't want to that person's life, you know, I think we can all agree, like, I always say this way, I have gained far more from hemophilia than what hemophilia has ever taken from me. Mm-hmm. Now, I've had some real losses, but you know, I've gained a lot from it. You said mental fortitude, right? And so, like, I think about my grandsons or, you know, even my daughter's like, I don't want to see that reverse. Like their life is far more valuable than the challenges that we will all face, right?
Yeah. I mean, all the opportunities that I've gotten just from having this blood disorder, you know, like I get to go to like these really fun camps, you know, and we get to go to events and eat good food and things like that, you know, like I'm always all happy, you know, so I think that also, you know, with the carrier, you know, like a lot of people say like, oh, I'm a carrier and that's it. You know, I've had people tell me when I would tell them, like I had a teacher one time, I told her, she was teaching about hemophilia and a lot of stuff she was talking about, I was like, I've never even heard about that. You know, and when I would ask my dad and he's like, I don't know. I don't think that that's right. And I told her, I was like, oh, I have hemophilia. And she's like, you're a carrier. I was like, no, I have hemophilia. She was trying to have an argument with me. And I was like, you don't even have it. I was like, why are you telling me this? You know, but that's how it is a lot of the time. You know, like people say, oh, I'm just a carrier because they're told that that's what they are. They're like, no, you don't have it. You're simply just a carrier, you know? Or even with the symptomatic carrier, I used to say that. And then after a while, I was told like, no, you have hemophilia. And I feel like that's something that women need to understand too. Like you shouldn't say, oh, I'm a carrier, I'm symptomatic. Say you have it because you do. You know, it's not just because, you know, you're not severe or moderate. It doesn't mean that you don't have it, you know, even if you're just a mild.
That's so important. Mm-hmm. So good. Ooh, you're fierce, girl. Come on. I love it. I love it. Raised a fierce advocate over there. She's. I know you got to be proud.
I'm very proud, and she's had a lot of strong women in her life too. Though I can say that I am where I am too because of that. You know, my mom raising me, first of all, the hardships that she's been through.
Yeah.
My wife, meeting her at 15 and putting up with me,
She's got to be fierce.
I mean,
I ask her sometimes, how'd you do it? Because, girl, it's...
yeah. And then her being born when I was 18, I wasn't raised by her, but her being born really pushed me to mature and see life differently, like, big time, so she changed my life dramatically. And then Dr. Matkovich, who was the doctor I worked for at the age of 21, I needed that tough love, and she set me straight. she set me straight, so I've always been around strong women, and that's why she's the way she is,
So good. Yeah. We need that. It's not just one perspective of the other. It's something about the blend of us all leaning on each other and being there for each other and having that communal support that's just so critical. I mean, there's a lot of focus, I think, today on things like mental health and all these other things, and it's like these segments of these issues. Sometimes we think that there's progress in isolation, but truly there's not. I mean, the reality is that there's only true progress when there is connection. And I think that's true in science. I think that that's true in our human nature to need, peace in our own thoughts. I think that's true in a family. That's true, and one of the things I so appreciate and just love about your family dynamic and just so many things that you've talked about is just this willingness to communicate and be transparent and vulnerable with each other and be honest. Like that, you can't underestimate the value of just being honest with yourself and being honest with others around you. And one of the things that I so love, Ivan, just about your commitment is I think it's awkward for a lot of men to talk about these things and to want to be vulnerable and to be, I mean, you and me are two like pretty emotional guys and we're like passionate and, and all that. But I mean, not all men are wired that way. Like some men are very clammed up and some women are very clammed up, and so it takes different folks with different personalities and different strengths and so on. So it takes a blend of all of those things to really be whole. And I love that you have been so determined to push yourself and your family, and even now you're pushing us as a community to push towards wholeness.
Yeah. Well, it's a calling.
Yeah.
It's a calling, and you know about this.
Yeah. Come on.
I felt it, growing up. I always felt that there was something there. Somebody was watching over me, somebody taking care of me, putting people in my life. I started noticing, my wife coming in at 15, like I said, my daughter at 18, my son at 20, Dr. Matt at 21. The Lord was just lining them up for me, preparing me for what he had called me for. And
so good.
As a youngster, I made a lot of poor choices, and even now as an adult, I still battle with certain things myself, but I've always made that I've always put in the effort to try and be better every single day, and it was always because of my family. I just know I wouldn't be as motivated, I wouldn't be as inspired or as ambitious if I didn't have my family.
Or as healthy, probably.
Yeah.
I mean, really and truly, like you infusing yourself as an example and as the breadwinner and all of the things. It's like it's probably been the reason why you're not totally crippled today. I mean, we see some folks that are just in isolation that are really, really crippled up and don't take care of themselves as well. Probably could be improved if they had a stronger support system. And I love that that's helped you really.
Correct. Yeah. I just knew after my last real bad injury where I sprained my ankle. I was 21 or 22, and I knew that my ankle was never going to be the same after that because I sprained it. And I really don't know how I didn't break the ankle. I rolled it really bad on one of my kids' toys.
Nice. Yeah. Was it a Lego?
No, I don't know what it was, but man,
It's a Barbie doll.
Maybe I used to play with Barbies a lot.
I was too in pain that I just knew like, oh, this is not going to be okay. And from then on, my ankle's never been the same. But in hemophilia, stable is good, right? So my ankle's been stable. It hasn't gotten worse or anything like that. But yeah, I need to stay active because I need to work. I need to provide. I need to be out there. And in order for me to be out there, I need to be in good shape and stuff. And now more than ever, I'm starting to get back into better shape, and I'm trying to also inspire them to do the same. And, she's getting into her exercise routine too, but very important for us hemophiliacs to also stay active just to keep our joints strong, right? And,
so true.
And just our mental health in general. It really does help, but mainly my spirituality is what has kept me going, and really what gives me peace, happiness, and joy to keep going at life, because even though we've been through very difficult times, I've continued to find hope through God. So
that's so good. That's so good. I love that. Me too. I'm right there with you. And I know you are too. I think in all medicine, we would agree that this mind, body, and soul, mind, body, and spirit, right? And anytime you just, again, it goes back to that isolation thing. Sometimes we just think we can if we just isolate this one thing, we can fix this one thing, but it's not always that. Like, it takes the connection of all those things to make something whole. And that's true about mind, body, and spirit. Like, we just have to be whole, or else in all of those things, or else we're and they're interconnected. You can't just say, like, I can say all these positive affirmations in my mind and everything's going to be great. I mean, we've seen people like that in the community that are just like, well, I can just will myself out of having hemophilia. Okay, well, scientifically, you're still going to have to, figure out how to get an infusion, and it's going to have, and you're going to have to solve that problem too. It's not just one or the other, it's all of it. And, but I'm so inspired by just the journey that you've been on. And I know people listening to this are also inspired by your journey. And I'm really looking forward to hearing feedback from people on this, because I do think we're on the cusp of seeing really a catalyst of change happen for women with bleeding disorders. I believe that, you're on the forefront of this. My daughter's on the forefront of this. We're seeing a lot of women's conversations happening around the country. I hope standards of care will change. I believe we play, as patients, we play an important role in that. And I want to continue pushing the envelope. And, so whatever we can do to help continue to cheer you on and keep going, and let's do it together. I want to see all that happen. But just for anybody listening that might be struggling, is there any advice you'd give any other girls out there that are just going, man, I think I have this issue, but I just can't get up the courage to face it? Or I thought my Costco membership with my $500 of pads a month was normal. Any advice you would give them?
I would definitely say they have to educate themselves. First, make sure that they know what they're talking about. When they go to the doctor, present them with all the journaling that they did about everything that they've been through, like, their bleeds and stuff like that. And obviously documentation, like we talked about exactly with the journaling part. And taking pictures definitely helps. And also, like, not being afraid to speak up for themselves. They have such a great community here, people that relate to them and are going through the same things as them. So they shouldn't feel like they, have to hide and not be able to, talk about what's going on with them. So definitely that, speak up for yourself. Don't try and hide, and, because it is going to affect you until you're older, and when you have kids too, it's not going to go away. So it's better to start now than later.
That's so good. Sage wisdom. Goodness gracious. What are you feeding this girl? Oh my gosh. Sage wisdom. That's so good. Any advice, Ivan, for the dads out there that are just trying to figure out how to help their daughters?
Well, just stay involved, because I do see that a lot of dads don't really get involved with their children's care. And it's not just the daughters, it's the boys too. We see the moms go to the appointments most of the time, go to the events, and dads don't show up, or they do show up, but they show up just to be present, just to be there, but they're not really present, because I've talked to some that don't really understand. But I think it's there. At least they show up. I just think it's important for dads to really be present in their daughter's care, right?
So good.
If we want our daughters to be treated fairly, to be treated correctly, we have to be there to stand up with them, right? And empower them to speak up. Because unfortunately, for some, I don't know why they still do this, but they do neglect women. right?
It's true.
And it happens in a lot of different areas, not just in the medical part. So for me, it's always been about empowering her, and now she gets to empower other young ladies and women in the community. But for dads, stay involved, be active in the community if you can, learn as much as you can, because your daughter's going to need your help when she's having kids and she decides to have her own family.
So good.
And you don't want her to go through this on her own.
So good.
So we have to be present, man.
So good. So true. Wow. Well, thank you so much for all of this. I know this is going to encourage a lot of people and inspire people. I really hope that we hear stories of people that are going to say, well, I'm going to get up and go get a second and a third and a fourth and a fifth and a seventh opinion, because I know that there's something wrong. I just don't know how to deal with it. But I think that just because of your courage and your bravery to tackle your own, challenges, but also speak out for others is really going to make, change in our community. So thank you for being here today. Thank you for being a part of this podcast. Thank you for being you and only uniquely you. You're doing a great job. And we're all over here cheering you on, saying, go, 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 do more, do better. It's going to be great. We're going to do it together. So keep it going. And thank you so much for being here today.
Thank you for having me. I'm very happy that I got to do this.
Yeah. Awesome.
It's always a pleasure to hang out with you, bro. Always.